Thank you, Mr. President. Well, we're back here again with another variation on the Trump plan and the Republican plan to do further damage to our economy and to the working men and women of this country. It's been sliced and diced and repackaged and unpackaged, but it still boils down to a very simple equation. Big tax cuts for the very, very wealthy and cuts to Medicaid and other key programs that are essential to Americans. This resolution is going to cost a lot of money, about $5.8 trillion with a T. Now, today, President Trump unveiled, or yesterday, I should say, unveiled his tariff policies, and today, the markets reacted. They lost $2.5 trillion in value. So he is just taking a sledgehammer to our economy and a sledgehammer to the working families who depend upon these programs like Medicaid, and a sledgehammer to our universities and medical schools and research laboratories, which have made us the premier center for research, innovation, and healthcare in the world. And with these sledgehammer blows, I don't think we can maintain that status. These proposals by the President and my Republican colleagues are designed to take away the health care coverage from millions of Americans, seniors, kids, veterans, individuals with disabilities. And they particularly seem to focus on Medicaid. Now, Medicaid provides essential health care services for the most vulnerable populations of the country. It covers nearly 80 million people if you combine those covered by the Children's Health Insurance Plan, CHIP. In my home state of Rhode Island, over 300,000 people, and that's about 1/3 of my state, depend on Medicaid. And the Republicans are talking about cutting this program by $880 billion, which would be devastating. And looking at the Medicaid recipients in Rhode Island, it's interesting. 1 in 5 adults aged 19 to 64 are covered. 1 in 3 children are covered. And we all know how critical it is for health care for children, because a childhood problem left untreated can lead often to much more serious health consequences as they grow older, much more dependency on social programs, which are paid for by us. Good health care as a child guarantees, in many, many, and most cases, success in school, success in life, and a healthy life. 1 in 3 children. Now, 5 in 8 people residing in nursing homes are receiving Medicaid. So let me tell you what's going to happen when Medicaid is cut by this extraordinary amount of money, $880 billion. A lot of nursing homes will close because their margin, the difference between opening the doors and closing them is the Medicaid money they receive. When that goes, where are you going to put your ailing mother or grandmother? I'll tell you what to do. You're going to do it like they did it before Medicaid. When I was a young kid, it was not unusual to go visit someone, and in the front room, there'd be the hospital bed and the grandmother, and the mother was taking care of the person, and that was health care back then. But after Medicaid, we were able to create a much more effective health care system. And this will touch not just the very poor, this touches the working families. It's the only way they can keep really their mother or father or older relative or a child with a very serious illness in a safe, protective place where they can receive appropriate care. Now, 3 in 7 Medicaid recipients in Rhode Island are working-age adults with disability. Now, this is a situation where these people, because of their physical limitations, cannot work, need assistance. Some are severely disabled, others are significantly disabled. And they're going to be left literally out in the cold. And I must say there's a corollary here, because just a few days ago, the president announced that he was going to take the IDEA education program and move it into the Department of Health, which at the same time is trying to shed thousands and thousands of workers. So my fear, of course, is that, again, going back into my youth, the 50s and the 60s, that children with disabilities will be sitting in the back of the room by themselves, trying to keep themselves occupied, because what we have created through IDEA, a system of education tailored to the individual child's disability, will be unsupportable. And that's the kind of damage he's doing. And it's the working people, it's the families, it's the kids, and it's, I think, inexcusable. Throughout the country, 38 million children rely on Medicaid. 2.3 million children with disabilities, as I said, throughout the country rely on Medicaid. And also, as I said, throughout the country, not just Rhode Island, 7 million seniors count on Medicaid to afford nursing home care. So we're in a situation now where we are basically undercutting our healthcare system. And it's not just these people who feel it, everyone will feel it. If these Medicaid cuts go through, it will create so much turmoil in my state that our healthcare delivery system will be under great pressure, but I think so much pressure that it will not work. Where do people go when they don't have health care? They go to the emergency room. So if you or me or somebody we might even have health care insurance, and then we have a serious problem, well, we can go to the emergency room and just get in the back of the line that's going all the way around the block and through the parking lot and every place else, because these hundreds of thousands of people without health care, that's where they'll have to go when they're so painful they can't go to work. This is a disaster in the making. And again, we saw last week and weeks before President Trump talking about, I'm going to put tariffs in and we're going to fix the whole economy. Nonsense. It's a disaster. It's killing our markets. And once again, I'm going to go in there and take out Medicaid, et cetera, et cetera. It'll be a disaster. And I think we must avoid it. We are better off because of Medicaid. Better health care outcomes in this country. A different country, literally, than it was prior to the introduction of Medicaid, and a better country. It provides health care coverage for example, 17 million women of reproductive age, so they can have the health care they need. And it helps families grow and prosper. And by making seniors and people with disabilities get the care they need, we are, I think, living up to the aspirations of this country, which is to ensure that those who need care get care. You know, there's been a lot of men and women who have served in the armed forces of the United States, and I was proud to do it myself. And they weren't risking their lives so that a very wealthy individual could have 5 Mercedes rather than 4. They were risking it so kids could have health care who needed it, so their mother and father could have a place to be when they were sick and ill in their older years. And what we're doing, we're forgetting that sacrifice, and we're saying, no, we're just here to pay off the rich people who paid off so much through the president's campaign to get him elected. Now, one thing I want to emphasize, which is very important and often overlooked, going back to Rhode Island, 74% of adults in Rhode Island and Medicaid are working. There is this insidious notion that this is just a free giveaway to people who don't work, who don't deserve it, etc. That's why we can get rid of it. 74% of the people on Medicaid are working, and they're working very hard. Oh, and by the way, my guess is they're not going to get a big benefit from these tax cuts because they're minimum wage or a little bit more. So we are really doing something that is so unjust and I believe un-American, of rewarding the wealthy, some of whom have worked hard to get it, some of whom just were lucky enough to be born to the right parents, and we're giving them a fortune, and we're taking away basic health care from working men and women. So we are in a very, very difficult situation. I don't think we can touch Medicaid. And for the moral reasons I tried to suggest, and for the economic reasons. If those 74% of Medicaid adults who are working can't get to work because they're ill, how do we get the jobs done? We don't. And the impact on the nation in terms of these cuts are going to be horrendous. And this impact is going to be every place in the country. I talked a lot about Rhode Island, but one of the ideas the Republicans are advancing to cut Medicaid is to eliminate the Medicaid expansion provided for under the Affordable Care Act. Now, according to the Urban Institute and the Robert Wood Johnson Foundation, this cut would cost 41 states over $44 billion. States would have to increase their share of Medicaid spending by 25%. States like North Dakota, Indiana, Montana, and Nebraska would see their costs go up by 30%. So I hope my colleagues from these states are ready, willing, and able to go out and tell their constituents, your health care costs are going up 30%. Now, obviously, I oppose this resolution that is being proposed. We have to do more, not less. And it's not just about the moral commitment I feel we have to people who need health care coverage. It's about the economics of caring for people early before it becomes more expensive, providing facilities for people who need those facilities rather than let them languish at home. And Mr. President, with that, I would yield the floor.